it's nerve-wracking for you, but especially for them because they're the ones who experience the losses leading up to this decision to go forward with you as their carrier. So what was it like? Was it a very delicate experience? I can imagine communicating with them.
Yeah, I think it's interesting because the intended mom and I have a little bit of difference in terms of our, um, I guess, attitude toward things. Like, I mean, it's obvious that, she's coming from the background of losses. And so it's so understandable. And I think even any optimism or joy, that was shared came with some caution. For me, I tried to just embrace and take day by day. And so that's what I mean when I say there's kind of a difference. And I think in some ways, I don't know if that was helpful to her or not, but I was like, it's great. Like, I hope that you can be happy about this. And, she kind of joked that she won't feel 100% content until the baby's like in her arms,
Well, that happens so often. You've never experienced failure in this area.
I
And so
know.
a lot of carriers in your position, hey, I'm pregnant, I'm excited for you, it's going to be great. And intended moms who've gone through multiple miscarriages or problems, they're like, just let me know when the baby's here, okay? And I'll
I
be
know.
happy at
I
that
know.
time. But right now I'm very nervous for the long time. Yeah.
I know. And I honestly, I think my background as a psychologist has helped me to try to be very empathic toward that and
Right.
understanding. And I do. And at the same time, whether this is a good thing or not, I'm sort of looking for help validating that there's no need to kind of panic right now. Like, this is what the physician said about this. Like, we can be reassured by this. Like, let's look to outside objective sources to
Right.
try to help to neutralize some of that distress or concern. But I understand it's totally natural.
Yeah. And it really is. And sometimes you have to hold back a little bit on your enthusiasm just because it's going to be met with worry on the other side,
Yeah.
and you're doing your best to appreciate that difference in her background,
Yeah.
especially. So what has, as far as where you are now, you've the IVF clinic is usually involved for the first 7 or 8 weeks or so, and then they step aside, and you are now a regular obstetric patient going for what I guess is still monthly appointments. Is that right?
Yeah, so the IVF clinic is involved until 10 weeks, basically, until the medications are stopped. And that's the time that you're kind of discharged to the OB clinic. And um, so I mean, every OB clinic is a little bit different in terms of their schedule, but generally they kind of follow the similar pattern where there are not as frequent visits initially, but then they get more frequent as the pregnancy goes on. And so for this one, it was a 12-week, 16, and then the 20-week ultrasound. And then my next one now is not for 6 weeks until 26 weeks, but I'll do the gestational diabetes screening. And then I think it goes monthly for a bit, and then every 2 weeks, and then every week toward the end.
Yeah,
So
just as when you were pregnant on your own, right?
yeah, exactly. Or at least that's like what I'm imagining from
Yeah.
when I was pregnant on my own. I don't
And maybe a
essentially
few
know.
extra ultrasounds because of this, but so far, I'm obviously you're in great shape, and that's the most important thing. But were there any scary moments, or there were any things that happened that kind of worried even you? Certainly, the intended mom's been worried over the course of things.
Yeah. Yeah, there definitely were a couple. So I think around 9 or 10 weeks, I had a little bit of spotting, and I went in, and everything looked okay, and it resolved, and they felt that that was very normal. They did find something called a subchorionic hemorrhage, which is basically a little bruise from where the placenta implants on the uterus,
Mhm.
and apparently it's a little bit more common in IVF babies. And so that was something that came up, but it was very small, and I hadn't had any recurrent issues for a while. And then around 16 weeks, I had some more significant bleeding that lasted for a couple days, and that was pretty scary. And I wasn't
Yeah.
really sure what was happening, but all of the testing, the ultrasounds, the exam, everything was totally normal. And we were reassured by the OB that this happens sometimes for some people. And the placenta is essentially a bunch of blood vessels. And so just even like subtle shift could result in the bleeding, but there was nothing to indicate concern. And I haven't had any issues since then. So
How are you
fortunately.
doing? How are you doing with sleeping? And did you have a lot of morning sickness this time around? What was that like?
Yeah, not as much sickness. I had more in the very beginning, it was more just a general aversion to most foods. And so that was a little bit hard. Nothing really seemed appealing. And so I actually lost a little bit of weight, and we had to kind of modify things a little bit so that that would not continue to happen. And then I was very tired during the first trimester. And I think that, to be honest, I think the added medications may have affected that a little bit. But once I stopped the medications around 10 weeks, I actually, within a matter of a day or two, felt a lot different and better. And I've been feeling great since then. So I think the medications just add a little bit
Yeah,
to what
it's
might already
designed, it's
be
all
there.
designed to help the pregnancy stick and be preserved and all that. And you know why
Right.
it's done.